Good afternoon, everyone. Thank you for joining us today. This series was made possible in part through the generosity of Amgen, and we thank them for their support. My name is Heather Jordan, and I am the Associate Director of Public Education at the American Kidney Fund. Before I turn the presentation over to today's speaker, I'd like to direct your attention to the control panel you should see on your screens. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We will see your questions and will do our best to answer them, either by replying to you in the questions box or out loud during the last several minutes of the presentation. This webinar is being recorded and will be made available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. For those of you in attendance who are healthcare professionals, we're glad that you've joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education credits, and you will not receive a certificate upon completion. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Without further ado, allow me to introduce today's speaker, Sue Ellen Anderson Haynes. Sue Ellen was born in Jamaica and was raised in Florida for most of her life. She is a registered and licensed dietitian nutritionist and certified personal trainer with interests and specialties in diabetes management, weight management, and women's health. She earned her Bachelor of Science in Food Science and Human Nutrition, specializing in dietetics with a minor in health science education at the University of Florida. She received her Master of Science in Nutrition and Wellness at Andrews University and completed her dietetic internship at Florida Hospital. Sue Ellen is a member of the Academy of Nutrition and Dietetics with Massachusetts affiliation, Sports, Cardiovascular and Wellness Nutrition Practice Group, and Diabetes Care and Education Practice Group. She is also a member of the Boston Organization of Nutritionists and Dietitians of Color. In the past, she served on the Public Health Committee of the National Urban League of Eastern Massachusetts Young Professional Network. She was the workshop facilitator for Spelman's 6th Annual Blueprint Conference for Middle School Girls in Roxbury. She volunteered with the American Diabetes Association, assisted with fundraising, and walking in the Stop Diabetes campaign. She has work experience in the areas of bariatric nutrition, diabetes management, wellness and disease prevention, and maternal and child nutrition. Sue Ellen works at the Joslin Diabetes Center as a nutrition educator. She has a passion for helping people meet their nutrition and fitness goals and maintaining them for the long term. Disease prevention and proper management are cornerstones in her career. Thank you, Sue Ellen, for joining us.
Thank you for the introduction, Heather, and thank you, Ashley, for inviting me. So as many of you may know, diabetes is the leading cause of kidney failure among all major races in the United States. 1 out of 3 will develop diabetes, so it is a serious public concern. My aim today is to give some guidance to those with diabetes and kidney disease. So let's take a look at these objectives. First, we're going to explore the role of our kidneys and how chronic kidney disease and diabetes are connected. Then we're going to examine the risk factors and ways of preventing diabetic kidney disease. Then we're going to discuss lifestyle approaches, including nutrition therapy for managing and improving diabetic kidney disease. Here are a few terms or abbreviations that you may hear during this presentation. Blood glucose is another name for blood sugar. Chronic kidney disease is also CKD, and DKD is diabetic kidney disease. And last, you may hear the word renal disease, which means kidney disease. Next slide, please. So what do our kidneys do? First of all, we should know where they're located. They're actually in the middle back in the middle of our back. They're the size of a human fist, and they weigh about 6 ounces. They are the main detoxifying organs of the body. So they filter the blood by removing waste, toxins, and drugs or metabolites or excess water. They regulate water balance and our blood pressure and the production of red blood cells. They maintain balance with different minerals such as calcium and phosphorus. And also, the kidneys help maintain vitamin D to strengthen our bones. In essence, the kidneys are the most vital organs in maintaining homeostasis and optimum health. Next slide, please. So how are kidney disease and diabetes connected? Well, first, there are different types of diabetes, and regardless if you have type 1, type 2, gestational, whatever diabetes that you may have, the goal is keeping your blood glucose in a good range. According to the American Diabetes Association, fasting when you're not eating or between meals, your blood sugar should be between 70 and 130. And 2 hours after your meals should be less than 180. And your A1C, which is the average of your blood glucose over 3 months, should be less than 7. When your blood glucose is poorly controlled or elevated for several weeks, months, years, it can lead to complications such as kidney disease. And your fasting is going to be over 130. Your 2-hour premium is going to be 190, 200. Basically, these are the guidelines that you would use to see if your numbers are in range. So today, we're going to focus more on kidney disease. Next slide, please. When diabetes becomes out of control, like I mentioned before, and blood glucose are consistently elevated, you may develop problems with your heart, your eyes, your nerves or healing and circulation. And as we said earlier, one of those complications could be a lowered kidney function. So today we're going to focus more on the kidney function section. Next slide, please. So there are 2 values that are used to help diagnose chronic kidney disease. The first is the GFR. GFR shows you how well your kidneys are currently filtering waste. It varies from blood draw to blood draw, so it may not be the exact number. However, the value does not improve. It actually decreases as we age. And it starts at age 40, you lose about 1% per year. The other value used to diagnose chronic kidney disease is albumin and creatinine ratio. This measures how much protein is in your urine. The less protein in your urine, the less damage to your kidneys are done. The normal range is under 30. Anything 30 to 300 mean you have small amounts of protein in your urine or microalbuminuria, and 300 or more means you have a large amount of protein in your urine. There are medications that can improve with this ratio. So as you monitor these values with every regular kidney visit, you will see that it's important that getting your checkups is important. Without getting regular checkups, you wouldn't know how these values are doing. Next slide, please. So chronic kidney disease can be identified in 2 ways. First, kidney damage. First, the classification is kidney damage over 3 months, which means that the structure and the function of your kidneys are different. This can be done with MRI, certain medical procedures. They could see the structure of your kidneys are changing. And this may happen with or without elevated GFR. And your urine or blood test will be abnormal. The second way to identify the chronic kidney disease is with or without kidney damage for 3 months or more, but your GFR is less than 60. So these are the 2 identifying marks that are used to diagnose. Chronic kidney disease has 5 stages, stages 1 to 5. The stages get progressively worse as kidney damage increases and the GFR decreases. Stage 5 is kidney failure, which means that your GFR is less than 15, usually means you need to start dialysis or think about kidney transplant. Next slide, please. So now let's talk about some complications of kidney disease. Earlier we mentioned the function of the kidneys. Now you can kind of understand the opposite as to when the kidneys aren't working. So we talked about red blood cell production. You'll have a lowered iron deficiency, and you'll start getting anemia. You'll have mineral or bone disease, where we talked about calcium, phosphorus, and vitamin D. So you could develop mineral and bone disease if your kidneys aren't functioning well. Also, something may occur such as hyperkalemia, which means you have too much potassium in your body, and it can affect your heart. You'll have swelling or fluid retention. So these are some of the complications that can arise with lowered kidney function. Next slide, please. So what is diabetic kidney disease? It is a long-standing or poorly controlled diabetes that can result in a type of chronic kidney disease known as diabetic kidney disease. So in a nutshell, diabetic kidney disease is a type of chronic kidney disease due to very long-standing high blood glucose and other factors that we're going to discuss today. Next slide, please. So it involves protein in the urine, high blood pressure or worsening of high blood pressure, poor blood glucose control, as you mentioned earlier, and it may include a genetic background, such as your family member or family member you may know may have this disease. So these are the risk factors for obtaining diabetic kidney disease. Next slide, please. Oh, excuse me, these are the risk factors. The risk factors for developing diabetic kidney disease are your race, race is increasing among the Native Americans, Hispanics, and Black cultures. And actually, Blacks are 36 times more likely than whites to develop diabetic kidney disease. Having diabetes is a risk factor. Genetics, as we explained earlier, family history. If you're at a certain age, typically if you're older, 60 or above, if you're a smoker, and also if you have existing complications with your diabetes, such as nerve damage, neuropathy, or eye damage related to the diabetes. Next slide, please. So how do you prevent or manage diabetic kidney disease? So first, your healthcare provider will look at a couple of screening tools, and some of the items they may collect is a urine test to make sure that you're not spilling protein in your urine. They'll look at certain blood tests. They'll also look at your lipid levels, your red blood cell levels, and bone markers for bone health. They look at all these values to make sure that they are in check, and if anything that is out of check, they will try to manage it with the appropriate tools. When you have type 1, screening and prevention and management, it happens at diagnosis when you're diagnosed with type 1, and then it should happen every 5 years at each visit. For those with type 2, screening should happen at diagnosis of type 2, then every year after that. Next slide, please. So these are some things that we monitor. Continuing from the last slide, your blood pressure, we want to make sure that's in a good range. So your blood pressure should be, the goal is less than 140/80. And if you have diabetic kidney disease, it should be less than 130/80 or less than 130/70. You should be checking your blood glucose and recording your numbers to track any trends. Your A1C, the goal is less than 7. And your fasting goal is similar as what we discussed earlier, 70 to 130 or 90 to 130. And your 2-hour post-meals are always less than 180. Some of these values may vary if you're on dialysis. Another way that they can monitor how well you're doing with your diabetes is also using something called a continuous glucose monitor, which monitors your fluctuations in your blood glucose throughout the day. Monitor that you attach to your body. And your healthcare team will monitor all these labs we talk about several times per year, depending on your stage of kidney disease. And then what we're going to talk about next is lifestyle and diet modification. How do you manage and prevent with lifestyle and diet? Next slide, please. So to ask the question, how do you manage or improve your diabetic kidney disease? And the answer, we're going to talk about some of those lifestyle changes today. Next slide, please. So in terms of nutrition and diabetes, there are three major macronutrients that affect our bodies. Protein is one macronutrient, carbohydrate, and fat. We're going to focus more on protein, but I just want to clarify how these three macronutrients affect our body. So protein has minimal effect on our blood glucose or blood sugar. Carbohydrate has a large effect on our blood glucose, and it turns 100% into glucose in our body. Fat, a large amount of fat can affect our blood glucose at a meal, but particularly small amounts of fat will not affect our blood glucose. So now let's talk about healthy plates on the next slide, please, and how these nutrients should be placed. So here we have a healthy plate, our Joslin plate that we use here at the clinic, and this plate emphasizes how you should eat your meals, particularly lunch and dinner meals, and it talks about the balance of each nutrient. So on the left we have milk and fruits options. Make sure you're getting your servings of calcium, vitamin D, and your nutrients, vitamins and nutrients from fruits. Those are carbohydrates, and we'll talk about that in a minute. The half of your plate has non-starchy vegetables, which we all need. They're very low calorie and they do not influence your blood glucose as much. The other 1/4 of your plate to the right is protein, meat, chicken, fish, eggs, tofu. And like we said earlier, it does not influence your blood glucose to a large effect. And the carbohydrates, the starchy foods. So basically the foods on the left, the starchy category, the bread, the rice, the pasta, the starchy foods, and the milk, yogurt section, and fruits are the major components of what increases your blood glucose. Next slide, please. So now let's talk about a little bit what carbohydrates are. They include bread, cereal, pastas, beans. Beans are a type of a dual food. They are protein and they're carb. Juice and soda and sugary desserts, which we don't encourage often, but they are carbohydrates. Next slide, please. So carbohydrate counting is very important in managing your blood glucose. So your blood glucose goes up or down depending on your activity, medication, and the foods you eat. And so carbohydrates are listed on this page. This gives you a kind of example of the categories we discussed on the plate. So if you think about that plate we just saw, this diagram kind of summarizes some of that. So we have the starch group on the plate, which are the bread, cereal, the beans, the crackers, and starchy vegetables. And then we have the milk and fruit section that was on the left of the plate. And then we have the sweets and desserts, which was not on the plate. So the very top, it states that one carbohydrate choice is 15 grams. Counting carbohydrates will help keep your blood sugar balanced throughout the day. Once you know how to count carbs, it will be much easier in maintaining a good level. So 2 slices of bread is 15 grams, 1 slice is 15. If we go down to a cup of milk generally is about 12-15 grams. And we look up to the very top, corn, half cup is 15. So each of these foods are 15 gram servings. The other part of carbohydrate counting, which I don't have on the slide, is reading a food label. So you want to get familiar with that. You want to get familiar with counting carbs or looking at a plate and identifying what foods influence your blood sugar. Next slide, please. So people always ask, how many carbs should I get at each meal? And one of the answers we give as general answers, most men need about 45 to 60 grams of carbs per meal. Now, if you think about that plate, if you picked the dairy or you picked and you picked the fruit, those are 30 if you get the serving sizes as we mentioned before. And if you had a sandwich, 2 slices of bread, that would be 30. So together that meal would be 60. Most women would be about 30 to 45 grams of carbs, so a little less. And snacks are berries often, but the typical kind of guide for most patients are 3 meals and 2 to 3 snacks. But everyone varies depending on their schedule. But the overall aim is to not skip meals. Skipping meals does cause fluctuations in your blood sugars, and sometimes it makes you don't feel well, you get lows or highs. So we definitely try to emphasize not skipping meals, just to aim to have at least 3 meals a day if you can't have the meals and the snacks. Next slide, please. So overall, to summarize, the lifestyle changes are, get into the habit of counting your carbs, whether you're using a tool, an app, a food choice list, using the plate to count your carbs, but counting carbs is definitely helpful. Measuring your foods will also assist in counting carbs or keeping your weight under control. Eating more foods from home. The more meals eaten away from home, the higher in fat, sodium content of the meal. And then the last but not least, being active. Guidelines for being active is 150 minutes every week. And so that could be, walking for 30 minutes each day, and including some kind of strength training activity, whether it's lifting weights at the gym, whether it's doing some kind of resistant training, resistant bands, or using your own body weight. So you definitely want to incorporate exercise in your lifestyle. And then one of the most important things we like to emphasize with our patients is walking after meals. Walking after meals is very helpful. In terms of your insulin sensitivity, it increases. So your body doesn't have to work as hard for that meal and to bring your blood sugars down because the exercise is helping you. Next slide, please. So what does having diabetes and kidney disease mean? So it's the same principles as having diabetes and kidney disease. It just means that some of your medications may have to be monitored. Some may be added or some may be removed. Monitoring may increase a little bit. Different laboratory values may be collected, such as the albumin-creatinine ratio and GFR, as we spoke about. And your diet may have to be tweaked slightly. You may not be able to eat all of the foods you used to eat, so there's going to be a slight shift in your meal plan. Next slide, please. Next slide, please. Thank you. So what are some dietary concerns for patients with kidney disease? So as we spoke in the very beginning, the kidneys are responsible for filtering waste, for water and fluid balance, and these nutrients all play into the role of kidney disease. So we're definitely going to be looking at your sodium, whether it's in your diet or whether it's in your body, fluid intake, protein, potassium, phosphorus. So we're going to look at some foods, and we're going to see how we can modify what we eat to help reduce or manage diabetic kidney disease. Next slide, please. So some of the modifications that you may see within your food, you're going to be focused on the same balanced plate. So you definitely want to have half your plate low-calorie vegetables. The types of vegetables you eat may be different, but you definitely still want to have half your plate vegetables. Your carbohydrates, as you mentioned, the starchy foods or the fruits and dairy, they may change a bit, but you definitely still want to incorporate carbohydrates. We don't want you to eliminate them. And your food choices may be a little different, and we'll talk about why that is. Dairy products also may be limited on some of kidney disease diets, and protein sometimes may be restricted. So on the next slide, we're going to explore more how meals can change with the diagnosis. So let's go on to a low-sodium diet. So when you're on a low-sodium diet, the goal is that you're picking low-sodium foods. So to reduce sodium, you want to try to use fresh foods instead of frozen or packaged foods. If you're using canned goods, stick with the low-sodium version of the canned goods. And when you're looking on the label, a food label, aim for 140 milligrams or less. And definitely, as we discussed earlier as well, dining out gives a lot of challenges because you're not sure what's in the food, how it's made. but ask the food to be prepared without salt or request that sauces be on the side of your meal. But low sodium foods in general are fruits and vegetables. And of course, the high sodium foods are processed foods, chips, um, fries, a lot of canned items, and frozen foods are also high in sodium. Next slide, please. So with kidney disease, at times the healthcare provider, your physician may order fluid restriction because your kidneys aren't able to filter out the excess fluid. And fluid consists of water, soda, juice, coffee, tea, any of these items you see here, anything that's liquid at room temperature. And why do they do this? Again, because your kidneys aren't able to filter out that excess fluid. It may affect your blood pressure, and it also may cause excess swelling. So it's very important that you listen to your doctor's orders or your healthcare provider's orders about restricting fluid if it comes to that point. Next slide, please. So if you think about that plate we mentioned earlier, we just want to talk about that one section of protein. So if you are diagnosed with diabetic kidney disease, then your diet may change slightly, and you may need to restrict possibly the amount of protein that you eat, or lower the amount of protein that you eat. For example, the recommended daily allowance for protein is 0.8 grams per kilogram. So if you weighed 160 pounds, for example, your daily protein intake would be about 58 grams per day, which looks like 3 to 4 ounces, which is a deck of cards. Deck of cards is about 3 to 4 ounces. Deck of cards for lunch, deck of cards for dinner. That's what about 58 grams looks like approximately. And at most times when you have kidney disease, you want to keep your protein around this range, 0.8 grams per kilogram. Your dietitian or your healthcare provider will help calculate this amount for you if you are uncertain. However, if you're on dialysis, your protein needs will increase due to the loss of protein during the dialysis. So you may go up to a much larger amount of protein per meal. But when we think of protein, to help you remember what it is, try to think of anything that walks or roams, swims, flies. That may give you a better idea of what the protein, for example, chicken, turkey, the byproducts, eggs, beef. There are other protein foods also, such as vegetarian protein foods, beans, tofu, veggie burgers. But not only that, cheese is a protein, and milk offers a good amount of protein as well. And again, 1 ounce of protein is 7 grams, but when you think about a normal size of protein that most people eat at meals, it's about 3 ounces, which is the size of a deck of cards. Next slide, please. So potassium is a nutrient we're going to discuss because when your kidneys aren't able to filter potassium properly, you may have to be in a potassium restriction. And low potassium foods are less than 120 milligrams, and high potassium foods are over 250. No one really would be in a high potassium diet. Usually you'll be in a low or moderate potassium. So let's look at some foods that are low in potassium. So berries, cranberries, lemons. Low potassium foods high potassium foods are bananas, potatoes, cantaloupe, oranges, some green leafy vegetables. This is just to give you an idea of what you can eat or what you may not be able to eat if you're on a potassium restriction. Potassium is also found in some dairy products as well. Next slide, please. Phosphorus is another nutrient that may need to be restricted if your kidneys aren't functioning well, and so balancing the low and the high is helpful. You're going to find a lot of phosphorus from any sodas. Usually they have quite a bit of phosphorus. Beans are healthy for you, but they have quite a bit of phosphorus, so you may have to limit them or eliminate them for some time. Nuts and seeds also have high potassium, and And yes, whole grain breads have potassium. Because a lot of patients ask, well, I thought you're supposed to eat healthy. How am I now not eating whole grain breads? But so the goal is that we're not taking away healthy foods from you because you're still able to eat healthy foods. It's just that we're tweaking it so that your kidneys are top priority. Um, Phosphorus foods are also high. Foods that are also high in phosphorus are dairy products such as cheese, milk, but low phosphorus foods are typically fruits and vegetables are low in phosphorus. White bread, you would have white bread instead of the wheat bread. Pretzels are low in phosphorus. However, the sodium content of pretzels you just have to consider or get low sodium pretzels. These are some examples of foods that are low in potassium, but there's much more out there. Next slide, please. So what are some tips for reducing your phosphorus intake? For those of you who like milk, you may have to reduce it. You may not need to eliminate it depending on what your levels are, your blood levels are of phosphorus. But a swap you can try is rice milk. So rice milk and regular milk, they both have carbohydrates. So you just have to match the carbohydrate amount and keep within your range of your carb goals in the day. And that would be unenriched rice milk, Cheddar cheese, we mentioned dairy products have high amounts of phosphorus. However, cream cheese has a lower amount of phosphorus, and it's an easy switch that you can try. Puddings, because they're made with milk and other products, are usually high in phosphorus, but you can try pudding made with non-dairy creamers that may reduce some of the phosphorus amounts. And instead of using diet cola, you can try to use diet ginger ale, because colas are usually higher in phosphorus, or lemon lime drink. We talked about wheat. We talked about brand breads, like whole grain brand breads. They have a significant amount of phosphorus. You can try to switch that to white bread or brand cereals. You could switch to rice cereal, and then oatmeal can be swapped for cream of wheat, and nuts can be swapped for popcorn or pretzels. So there's different swaps that you can make, and again, depending on your lab values, you may not need to eliminate these foods forever, but they may need to be reduced slightly in the diet. Next slide, please. So here we have a sample renal diet, or a diet that is kidney friendly, and this was taken from Jocelyn. This sample menu includes 3 meals and 2 snacks, as you can see. This renal diet is an example of what a consistent carbohydrate looks like. So when we talk about consistent carbohydrates, we talk about having the same grams of carbs around each meal. And as you can see on the left, breakfast, we have in parentheses, this is a 45-gram breakfast. Lunch is about 45 grams. Dinner is around 60, which is close to 45. So the carbohydrates are considered consistent carbs. These 2 snacks also are consistent in terms of how many grams of carbs, and their amounts are 15. So let's look at sample 1. Here you have a meal, a breakfast meal that's white toast, like we said, instead of the whole grain toast. You have some kind of healthy fat. You have some kind of fruit or tea. Sample 2, you have, instead of brand cereals, you may have like a cornflakes type cereal with rice milk. And you have a fruit on the side, plums, which are low in potassium. For lunch, there's a grilled salmon. So keeping the protein the size of deck of cards, the palm of your hand, that's about 3 ounces, combined with a carb, pasta, 2/3 cup, and lots of veggies, half your plate, with a little bit of healthy fat, oils, and dressings. And the next meal is sandwich. So basically the meals are always balanced with a protein, balanced with a carbohydrate, balanced with some kind of fruit, and then snacks. We talked about snacks earlier. You definitely don't need a snack, but it's helpful to have a snack, especially if you're going longer than 4 or 5 hours without something to eat. It's helpful to have that snack to kind of hold you off until the next meal so you don't overeat the next meal. or to help manage your blood glucose. Dinner meal is a little higher, but again, the same concept. You have your protein, about a deck of cards, 3 to 4 ounces. You have some carbohydrates, rice in the first sample. Second sample are noodles. You have low potassium vegetables, broccoli. We have asparagus on the left side. And then we have a fruit as a dessert, pineapple on the sample 1 and cherries on the sample 2. And then for the dessert, you have carbohydrate grams that are 15, just 3-gram cracker squares or 6 vanilla wafers. So this is a complete full day. 2 examples of what consistent carbohydrate looks like and what a diet looks like that's kidney-friendly, low in potassium and phosphorus and sodium. Next slide, please. So in summary, you want to make sure that you get your regular checkups to monitor your lab values and your blood pressure. If you're not monitoring, you have no idea how well you're doing or if things are changing. You definitely want to take your medication as prescribed, as prescribed by your provider. Different medications can alter a lot of different values in your body and can affect your blood glucose and your kidneys as well. So make sure you take your medication as prescribed or call your provider if you have questions. You want to improve blood glucose control. And how do you do that? We talked about lifestyle changes. We talked about exercise, especially walking after meals. We talked about consistent carb intake, not skipping meals. And then monitoring your blood glucose daily. In order to see if everything's working together, you have to monitor and keep a log of your blood glucose numbers or, your blood pressure, what's improving, what's not improving. And you bring these numbers to your visits to discuss with your provider. You want to focus on lowering your blood pressure, stress management, exercise, and not smoking. Everything we talked about today can also help with lowering your blood pressure, reducing the sodium in your diet. Follow your meal plan and adjust when needed. So you definitely want to make follow-up appointments with your dietitian or your nutrition educator to modify your plan and to make tweaks when things have changed in your lab values. The next thing you want to do is keep up with your activity, as you mentioned earlier, and maintain a healthy weight as best that you can. And last but not least, you want to stop smoking. So we have concluded presentation. Next slide, please. Any questions?
Thank you so much, Sue Ellen. We do have some questions from our listeners. So I'll start with why are the screening schedules different for type 1 versus type 2 diabetes?
Oh, that's a good question. The progression of kidney disease is different for type 1 versus type 2. So at diagnosis for type 1, you are screened at diagnosis and then 5 years after that until they see any changes. And then for type 2, you're screened at diagnosis and then yearly after. So in type 2, the progression of complications is more dramatic than type 1, and so the screening tools are based on some of that information. So that's the main reason.
Great, thank you. Just a follow-up to that question, why does type 2 progress more quickly than type 1?
Why does type 2 progress more quickly than type 1? I'm not quite sure why it progresses more quickly, but we do understand that when people have type 1, they've had pre-diabetes for some time, and the inflammation process has been ongoing. And so when we catch a lot of people with type 2, it has progressed for many years, and the process is just a little faster for one reason. Whereas type 1, you are born with a gene, and it doesn't start to turn into type 1 until you have an environmental trigger. You have an environmental trigger. you have an environmental trigger, and then from there on, it starts progressing slowly. So I'm not sure if I answered that question correctly. But that may be a question better answered by maybe a physician. But that's the background that I have for you.
Great, thank you so much. So some of the foods that are better for people with diabetes, such as wheat bread and brown rice, aren't good choices for people with kidney disease. So how do you manage balancing your diet appropriately when you have both kidney disease and diabetes?
Yeah, great question. I get that question often. So yes, in general, whole grain products are typically a little bit healthier because of the fiber content. The carbohydrate grams are still the same. So the goal for the dietitian, for the patient, is to keep your carbohydrates in a good level so they are not causing a stress or increasing your load or your blood glucose numbers at meals. So that's the number one priority. Keeping your nutrients in balance, that's the second priority. So if you have kidney disease, we definitely don't want to make the kidney disease worse by giving you food that's going to affect your kidneys. So the white bread, less phosphorus, and if your body's not filtering out the phosphorus properly, you definitely don't want to compound that problem. It doesn't mean that you'll never be able to eat whole grain breads. It kind of varies on your levels. There are medications that you can take to lower phosphorus levels, and you can enjoy some of these whole grain products, which has more fiber, some benefits of fiber that you may be missing a little bit with eating like refined white bread or cereals. So it's not that the foods are unhealthier, it's just that the goal is a little different. So I hope that answered your question.
Yeah, it does indeed. Thank you. Just to jump back really quickly, we had a question come in from an audience member asking if you could provide an example of an environmental trigger that would kick off or spur the onset of type 1 diabetes.
Okay. The environmental triggers could be like severe stress. It can be some kind of inflammation, some sickness or illness that you're going through that kind of puts the immune system compromise your immune system, which therefore triggers the response of your cells to kind of attack your pancreas. So those are a few examples of environmental triggers. It could be chemicals. It could be exposure to chemicals, exposure to certain foods. It could be different, like illness. Different triggers that can cause that can cause a type 1 to can cause someone with these genes to progress to type 1.
That's really helpful. Thank you. If I feel I might be at risk for diabetic kidney disease, I have diabetes but I don't have kidney disease yet, should I begin limiting fluids, potassium, or phosphorus preemptively?
No. What you would want to do is make sure you go to your regular visits and get your laboratory values done. You want to get your urine test, you want to get your blood pressure, you want to get your creatinine albumin ratio, your GFR. You want to get all these blood values or these tests that the provider will give to you to make sure that your kidneys are functioning well. If they see a small change in any of these numbers, they will discuss with you, and then you can make changes then. But right now, the way you want to eat, if you know you do not have kidney disease, is making sure you keep your blood glucose in good control. The ranges we discussed, 70 to 130 when you're not eating or fasting, less than 180 2 hours after a meal, keeping your blood pressure a good control, eating a healthy diet, and being active. That in itself will help reduce complications or delay complications in the future.
Great, thank you. We had a question from the audience on, they would like you to elaborate a little bit on the fluid intake requirement for people with diabetic kidney disease.
Okay, what do you mean by elaborate? What exactly do you need? They want to know. They want to know what a fluid restriction looks like, or I'm not sure.
I think maybe if you could talk about how the fluid intake restrictions change once you go on dialysis versus while you have diabetic kidney disease but are not yet on dialysis?
Yeah, so currently where I am, we don't see a lot of, it's not a dialysis unit, so a renal dietitian or her dietitian who specializes in kidney disease can go over this a little more in detail, but I'll try to answer the question as best that I can. So when you are on a fluid restriction, that may be, that usually is in dialysis, and they base it on how much fluid you're retaining or fluid you're able to release with the dialysis, and they give you milliliters amounts or cups that you're allowed to have each day, or ounces, and they kind of walk through with you what you can have. For example, a half cup of water or a cup of water each day you can have, plus a cup of juice. So they go through all the levels with you of what you can and cannot have. And the reason is because your kidneys aren't able to filter out and produce that balance of water and mineral that's holding on to the fluid, and blood pressure can become very high. So in efforts to reduce the pressure, to reduce the stress on the kidneys, they restrict fluid to make it a little more easy for your kidneys to function. So when you're not on dialysis, I'm not familiar with those that are on fluid restrictions. The physician may put them on a fluid restriction if they feel that they're extremely swelling or there's other things that are going on. They may be prescribed a fluid restriction before even going to dialysis. So yes, there's different reasons why someone could be on fluid restriction. It could be prior to dialysis for swelling or other blood pressure issues, or it could be during dialysis based on how much fluid is being taken off or how the kidneys are responding to the dialysis.
Great, again, thank you so much.
Yeah, and again, I'm not sure if I answered that the way that they wanted, because I'm not a renal dietitian. They may be able to better answer that question, but hopefully I was able to get through to that person.
Sure, yes, absolutely. Thank you. Do screening tests for diabetic kidney disease typically happen in a standard annual physical?
A standard annual physical, if you go to your PCP, and they know you have kidney disease, if they know you have diabetes, that should be a part of something that they collect, but not necessarily. You may need to talk to your PCP about that. However, if you come to a specialized clinic that specializes in diabetes, such as Joslin or any other diabetes clinic, they automatically they order those types of labs, because we know that this population is at risk for kidney disease. So it kind of depends on what type of specialist or provider that you are going to. It may or may not be included in a general annual summary, annual checkup. If it's your PCP, you may have to request it. And if it's at a specialty clinic that focuses on diabetes, they usually automatically include it.
Great, thank you. Are there any tools that can help patients with diabetes plan their meals around the restrictions of the diabetes diet and the kidney disease diet?
Okay, tools such as applications like apps or websites. What exactly?
I think any of the above. So any sort of tools that are patient friendly, that are easy for patients to use to help them track what they're taking in.
Sure. So we have a lot of different nutrition sources here that we provide for people when they come to Joslin, and I'll just name a few. So we have the calorieking.com, www.calorieking.com. This is a website where you can actually go to track your carbohydrate intake and calorie and fat intake. It's not per se where you log, but you can definitely look up various amounts of chain restaurant foods or everyday foods into this application where you can find nutrition information about the food. Another place you can track that offers a little bit of how much calories you're spending on activities and the content of your overall food is Calorie Lab. CalorieLab.com is one place. There's another website called eatright.org where there's helpful handouts on the website, more general handouts, but they have specific ones on diabetes and kidney disease, just helpful hints. And then there's a place called NutriHand Inc. NutriHand Inc. It's an online wellness center, and you can get a variety of information there. And then mypyramid.gov is very popular. Mypyramid.gov is a wonderful place because you can go to track your nutrients. It actually gives you a spread of all the nutrients that you're eating, potassium, phosphorus, all your nutrients. You just select it. And it also tells you how much carbs you're eating, like part of the nutrient analysis. So basically it analyzes your food. And you could log in and put your height, your age, and it will calculate your calorie level. And it could be a personalized approach for you. It's a good place to start. So these are tools that you could use in the interim until you see a dietitian to kind of give you more specifics. And another website is win.niddk.nih.gov. This is a website that has weight control information for people who's interested in controlling their weight as well.
Thank you. That was a lot of resources, and we really appreciate it. I have a couple additional questions. Have you found that a low animal protein diet helps to slow kidney disease?
The research is mixed, but low animal protein diet, so it depends. If you are already diagnosed with kidney disease and it may be helpful for that patient to switch to a diet that's low in, milk, yogurt, because essentially those are phosphorus foods and protein may be restricted, so they may have to restrict some of the chicken, meat, fish. So it may be helpful for those who are in that chronic kidney disease stage, beginning or end. But I'm not quite sure, what side the research is on to say that a vegetarian diet for sure will help delay kidney disease. But there's a lot of helpful benefits of eating a low animal protein diet or a vegetarian diet. There's a lot of helpful benefits with weight loss, keeping blood glucose under control. But there's other variety of eating patterns like Mediterranean eating style, vegan, vegetarian, so different types of eating patterns that research has shown to produce results that are helpful with weight management and blood glucose control. But however, the information about preventing kidney disease, what diet will help prevent kidney disease, we haven't found a lot of information on that we can say it's relevant to our patients. So there's mixed information basically about that. So it possibly can help the person, but we're not quite sure.
Okay, great. I just have one final question. Do you have some tips for somebody who is diabetic and is immobile due to physical disabilities? What can be done to help them lose some weight and become in better health to prevent diabetic kidney disease?
Yeah, and to prevent diabetic kidney disease, you said?
Yes, or to better manage it. Yeah.
Okay.
Mm-hmm.
Okay. Yeah, so in terms of someone with diabetes and wanting to delay or prevent diabetic kidney disease, and that's mobile, activity will definitely help. And if you're not able to move around, not sure how much the person is able to move, but if you're in a chair or wheelchair, there are exercises that can be done with resistant bands with the arms, if your arms are able to use your arms. There are YouTube videos out there on chair exercises. Not sure how much this person is able to move their legs and arms in the chair. You necessarily don't have to get up, but there are a lot of exercises that are out there on the internet that you can get for free, or videos that you can order. And as I said, resistant bands that you can use, as well as arm cycling machines that can be used in the house if you can order them. If you're able to order them and use them inside the home, that will be helpful, especially to get to be active after a meal. So in terms of the prevention, the diabetic kidney disease, following the healthy meal plan, and sitting down with a dietitian, or having a phone one-on-one conversation about reviewing what the person's eating and making changes from what the person's eating. So they may need to sit down with someone to see if what they're currently doing is working. And so that's in terms of nutrition, and in terms of the activity, they may want to try some of those suggestions I mentioned to improve, muscle mass, bone strength, and to just, help with the blood sugar, the blood flow after eating.
Great. Thank you so much. And thank you again for joining us today, for doing this webinar for us. It's been really informative, and I'm sure that our patients will find it to be a great resource going forward. For those of you in attendance, our next webinar will be held on Friday, December 9th from 1 to 2 p.m. Eastern Time. Our speaker, Dr. Keith Melanson, Director of the George Washington Transplant, Director of the George Washington Transplant Institute, will be with us to discuss paired kidney exchanges and the opportunities this method creates for kidney transplant in minority patients. Registration is open now. You can visit kidneyfund.org/webinars for more information and to register. When the webinar closes today, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar programs the best they can be. Thanks again to everyone for joining us today. Have a great week, a great Thanksgiving, and we'll see you next time.
Thank you for having me.
Thank you.